Hello again, this is Dr. Anthony Rackett at Euclid Chiropractic Clinic in Upland. We talked about this week is neck pain and really different aspects of when someone comes in the office, what as doctors, how we think, and also as a patient, what they should expect from some type of chiropractic care, even sometimes medical, based on what they're looking for. Okay. What we did first of all is talk about where does neck pain come from. Two things can happen initially, and when we break them down, is one thing could be from trauma, such as a car accident, a fall, a sports injury, something like that, at any age. It does not age related for one. Second thing is what's called insidious or an unknown onset. For example, someone wakes up with it, someone's leaning over the sink brushing their teeth and their neck spasms, or they're in a car and their neck spasms. When something like that happens, for me, that's more serious. What's going on to where without trauma, the neck can spasm, cause headaches, cause severe pain, to where it allows someone not to function properly in their life. The second part I talked about, besides where the pain comes from, is what the pain can actually cause. Two things can cause a pinched nerve, or a pinched nerve herniated disc is the same thing. I'll discuss that later down the line too. It comes from the same origin, where it's affecting the joint space, limiting motion, and causing things to lock themselves up. It can cause actually muscle spasm. Also, a neck pain can cause muscle spasm, and when it does that, that can resolve itself probably within 2-3 days. When I talk to patients about that, it's almost okay. It happened today. You can call me tomorrow. Let me know if it's residing, if it's getting better, it's getting worse. And by day 3, if it's not getting better, then I take an X-ray to see what's going on inside the spine. And the third part it can cause or come from is called arthritis. Not, if you want to call it joint pain like a rheumatoid arthritis, but arthritis we see on an X-ray where it's calcifying some of the bone. We have some pictures of that on the internet on our blogs all for this week. Once someone comes in with that information, we find out what's going on from an examination standpoint and also X-rays. X-rays for us tell us exactly what's going on in the spine. That's our gold standard as chiropractors in my office. When I say that, that means that only half of chiropractors out there take X-rays. So if you're not taking X-rays, from my perspective, and again, I'm Dr. Rackett at this Euclid Chiropractic Clinic in Upland, my perspective, I don't know how you find out what's going on in the spine. One thing, to validate some type of care afterwards, also to know it's safe to treat somebody. Not to get them 100% all the time, but at least know it's safe to treat them. Okay, so that's how we really look at the overall person and spine and figure out what's going on, and at that point give some reported findings and tell them exactly what's going on with their spine, maybe those different scenarios. When we talk about treatment, there's two types of treatments: medical, which is more surgically based, medication based, or wellness and chiropractic. I'm going to separate those and I'll tell you why in a minute. With medical, we talk about is two things they look for: is what type of medication can we give this person to sedate the symptoms, and or do we need to do surgery? Okay, realize medicine, the prevailing medicine type of paradigm belief system does not believe looking at X-rays first. That's down the line if it does not get better, being the neck pain. So first of all, we'll talk about medication. What are types of medication that you can be given? One is anti-inflammatory, one is a pain reliever, and another is more of an opioid. An anti-inflammatory would be more like a Tylenol or something like that. Pain reliever would be more like an ibuprofen or Relieve. Those different types because of the way they affect your body. Realize every medication you're given, every prescribed medication, has side effects. And I explain some of those in the blogs also to what they can be, give full lists of side effects. Every medication has a side effect, sometimes rare, of causing death. That's pretty serious to me. Okay? Why would I want to take my neck pain away if that's the benefit, but the risk is actually death? That doesn't make sense to me. I don't know why. The last drug, if you want to talk about, is called an opioid. And what that is something like a codeine, if you want to call it, I think naproxen also too, it's even Vicodin too. The problem with opioids, that's why they're classified differently, is that they have the same addiction rate as heroin. Okay, let me say that again too. They're very addictive, just like street drugs like heroin. So again, why would I want to take them for neck pain if it's going to make me addicted to it like heroin? It doesn't make sense to me. But the medical approach realized the reason their rationale for this is that their belief is that your disease, your sickness, your neck pain, whatever it would be, comes from weak genetics, meaning that our body's meant to break down, meant to get sick. Because of that, there's nothing we can do. All we can do is slow down the process through drugs or surgery. From a chiropractic wellness perspective, this is the other part of their other type of treatment. Chiropractic wellness perspective, we believe lifestyle causes sickness. We're all going to die sometime. We know that. But why, if you want to call it speed up the process, if we don't take care of ourselves through exercise, nutrition, nervous system, even attitude also. we talk about a chiropractor and what we do when we treat someone for neck pain. First we want to do is reduce the symptoms and how they feel. By causing joint mobility, is what I talked about last week on the blog, is really it allows joint motion to allow the body to want to heal on its own. It shuts down what's called a sympathetic response, to where your body has stress hormones that are, if you want to call it, stimulated when your body is locked up, when the joints in your spine are locked up. When you release or cause more motion in the spine, release what's called serotonin through different nerves that allows your body to relax and want to heal. Okay, once you get the symptoms reduced, meaning pain, numbness, weakness, whatever it may be in the neck, what we want to do next is allow the body to get stronger and return to more of a normal posture, normal positioning by causing some stretching first, then from there going to actually exercise. Some people say, well, why do you prescribe exercise? Because I want someone to realize not only will the exercise get them to feel better and motivate them to actually want to continue some type of care and lifestyle change, but also the exercise changes their habits. Most people that get neck pain that are insidious or a non-onset, where there's no real cause for it, have problems to where it's their lifestyle of hunching forward, of, if you want to call it non-exercise and even improper nutrition, causing them to have the neck pain. So we want to reverse that. So when I see some in the office, it's really to not only get them to feel better, but also change their lifestyle so they actually are healthier and stay healthier when they leave my office for one, or leave our office for one. Okay? So realize these are the goal of chiropractic, is to not only reduce the pain through adjustments and also through exercise and traction, but as a whole body, treat to someone to get them to feel and know that what matters to them is their health, is their lifestyle changes, and making sure they maintain that throughout their care, even beyond that too. Okay, we talked about this week is neck pain. I gave a presentation at the Gibbs Center down in Upland, and I had about 12 people to start with at my presentation, I was like, wow, what's going on here? People want to get healthier. These are seniors who want to get healthier. Most seniors after the age of 50 are on about 6 to 10 medications per day, because that's what they're told to do. They're told nothing else can help them. As chiropractors, we are the other option. We're not medical doctors. We're chiropractors. We look out for your lifestyle, not to give you drugs. Okay? Again, this is another if you want to call it video, blog, entry from Euclid Chiropractic Clinic in Upland. We're a whole body center, whole body health center. Enjoy health from the inside out. Have a great weekend. Thank you.